Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Logan, 10/6/1988.
Alright, so what I'm going to go ahead and do is take a little assessment of you, and then we're going to get into your diagnosis, okay? So her wires to her bed are off secure. Her bed is in a locked position. Her tubing is not kinked. She does not have a catheter. There's a full view to the bathroom, and there is no obstructions. So I'm going to go ahead and where are you today?
Home.
You're at home? Okay. And what is the date today?
March 26th.
All right. Your vital signs looked well. Your heart rate was 87, your respirations were 32, and your blood pressure is 123/77, and your breathing is 96%, so that's good. Are you having any problems when you're breathing?
No.
No? All right, so I'm going to go ahead and have you turn your head to the left. No jugular distension there. Go ahead and turn the other way. And none there. Okay, go ahead and relax. Are you having any pain in your upper arms or upper extremities?
No.
No? All right, and your skin is warm, cool, and pink to touch. She has no edema in her elbows or her wrist. Her IV site looks great. It's not red. It's not irritated. Do you have any tingling or pain in your IV site? No? All right. And she has fingernail polish on, so I'm going to go ahead and feel the tips of her fingertips. And they're warm, and her cap refill is less than 3 seconds, which is good. Okay. And then you said you're not having any pain, so you're not having any pain in your abdomen either? No? Okay, so that's a good sign because usually people with DKA and the symptoms that you're having have some abdominal pain. So I'm going to go ahead and listen to your chest, okay? If you have any shortness of breath, let me know. Okay, go ahead and lean forward for me. I'm going to go ahead and do your posterior. Okay, and go ahead and lift your arm for me. Okay, I'm going to go do your other side. Okay, go ahead and relax for me. So your lung sounds are clear. That's good. That's a good thing. And I'm going to go ahead and palpate your stomach and then go ahead and listen to your bowels, okay? You said you didn't have any discomfort? No? Okay. So her stomach is flat and not distended. And you had vowel sounds ×4. Are you having any slurred speech or anything like that? No. No? Having any trouble with your talking?
No.
Alright, so I'm going to go ahead and feel your pulses on both hands to double check that you can have them both bilaterally. And she has bilateral pulses. I'm going to go ahead and feel your legs. And they're warm, pink, and dry to touch. She has no edema on her ankles. Are you having any trouble urinating or going to the bathroom?
No.
No, and when was your last bowel movement?
Yesterday.
Yesterday? Okay, and are you having any gas?
No.
Okay. So I'm going to go ahead and talk to you a little bit about what you came in for, okay? So you came in with some flu-like symptoms, decreased loss of consciousness, and you had some heavy breathing. Okay, so basically what we figured out is that you have DKA and it's a diabetes. And we have found this by your labs that we took. So we took some Glucose test, we took a BUN, a creatinine, a urine, and they were elevated, and your urine was positive for ketones. So we know that what's going on is basically you're starting to be dehydrated and you could possibly have some kidney issues because your BUN was 39. Your glucose was 804, which is a very high and dangerous level. So our number one thing that we want to do is make sure that we're lowering your glucose because that could lead to some organ failure or some heart problems, even your kidney disease. So we're going to first give you a bolus of NS, normal saline for now, and then we're going to check back in about 30 minutes or so to make sure that your glucose level has gone down to 250, and if it has, we're going to go ahead and change your fluids. We also are going to check your BPM frequently because it will show any diabetes that's starting to happen, any kidney disease, and it's important because it shows whether your body is in normal functioning. It also gives us information about your glucose levels, your balance of your fluid and electrolytes, and the function of your kidneys. So after today, we are going to continue to give you insulin because it is going to help keep everything within normal limits. Okay? Are you having any questions so far?
What are the signs of this?
What is the signs of DKA? So different signs are going to be frequent urination, dry mouth, thirst, dehydration, nausea, and vomiting. You could have some abdominal pain. You could be very confused, and that's a sign that you came in with. So you came in with some level of consciousness decrease that your family noticed. And you also came in with some flu-like symptoms as well. And then you're going to feel pretty tired. Have you felt pretty tired lately?
Yes.
Yeah? Okay. So do you have any other questions?
When to call a doctor?
So you want to call the doctor if you are taking some insulin and your blood sugar is not going down or it's rising. Maybe if your insulin, you gave yourself another dose and it still isn't going down, you want to make sure you notify us as well. And then if maybe you are having some nausea and vomiting for more than 24 hours or you've been sick for more than 24 hours, make sure to give us a call. And lastly, make sure that your blood sugar isn't too low. If it is pretty low and you're getting shaky and things like that, you could give us a call. Any other questions?
How to prevent it?
You want to make sure that you're exercising, but making sure that you're still eating a meal beforehand. And you don't want to go exercising if your levels are too high or too low because you could get into some issues there. When you're exercising, it causes your sugar to increase. So you could go into some issues if you are already high. You also want to make sure that you're giving your insulin when you need to and you're not missing any doses. How about anything else?
What causes DKA?
So it's caused by insulin, missed doses, or illness. So traumatic illnesses can easily cause this. And you have any other questions for me?
What is DKA?
So DKA is a type 1 diabetes. It's when the body does not have enough insulin, and your body's then going to start using fat for energy. And when it uses fat for energy, it's going to cause some ketones to be developed. And when ketones are developed, your blood is going to start getting more acidic. So when your blood gets too acidic, then it causes DKA to occur. Any other questions?
No.
All right, so I am done with you today. If you don't have any other questions, I will be back here in a little bit to recheck your IV and make sure that your glucose level has gone down. And if it has, we'll go ahead and change it to a different rate. Okay? All right, thank you.